if you or a loved one is on estrogen hormonal replacement therapy, or you're considering HRT with estrogen and your doctor hasn't assessed your estrogen metabolites, your detox pathways, your adrenal and liver health especially, then this video is for you. The goal should never be to increase estrogen or necessarily lower it. We need to balance it. We need to understand estrogen. We need to understand their metabolites, especially if the first plan of care for most hormone specialists, OBGYNs, whoever, is to put a young lady on birth control. That doctor is doing that patient a huge disservice, because what they found with especially middle-aged women, following up 1 million of them that were on any form of estrogen therapy, including most common birth controls, they found that the development of breast cancer increased by 60%. 60%. And each year that a form of estrogen therapy was used, by 8 to 10% increase every year to develop some form of estrogen-based cancer. Now, if you're on any estrogen therapy, even if it's birth control, the most common endocrine disruptor on this planet, make sure your doctor is ordering a Dutch test. Why? This will show you all of the estrogens, all of the metabolites, and if we're going down this red pathway, like this patient was, because she was suffering with estrogen dominant symptoms, breast tenderness, heavy, painful menstrual cycle, feeling bouts of irritability and emotionalness during her menstrual cycle, which is not normal. It's a sign of estrogen dominance. She needed liver support, adrenal support, not more medications to suppress her body and create a long-term toxicity. So do yourself a favor. If you're struggling with estrogen dominance in cycling years, start eating things like raw carrot salad, white button mushrooms, steamed, bamboo shoots, citrus, and ginger. Why? Because these all support a healthier microbiome, fight against endotoxin and estrogen dominance particularly. And if you're in menopause, suffering with hot flashes, low estrogen, before you just take that hormone, make sure your doctor's discussing to you what has created the immune system stress to your adrenals, which is causing that estrogen loss in the first place. If you would like to set up a call and talk about the Dutch test and finally get hormones tested in the first place before there's any medication introduced, comment testing down below for some more information.